Your IT band isn't Play-Doh. You can't meaningfully stretch it any longer, and honestly, you wouldn't want to. But that sharp outside knee pain, we can fix it with a clear 4-step evidence-based plan to not only manage, but to prevent ITB syndrome from happening again. Hey, it's Kate Baldwin here, also known as the Distance Doctor. I'm a physiotherapist, sports scientist and researcher, and I'm here to help you not only run faster, but more consistently and pain-free. Today we're going to be talking everything about ITB syndrome. So what is the ITB? The ITB is a load-sharing, energy-storing sheet that links your glutes and hip flexor to your tibia. It actually isn't just superficial. There are deep fibres that tie the IT band into the distal femur, which is your thigh bone. Its primary roles is for stability, and it's key for helping keep the knee tracking nicely under fatigue, and it does play a crucial role in running economy. Now, the hallmark symptom of ITB syndrome is sharp outer knee pain that ramps up with running, especially when you're running downhill, and it generally does settle with rest. It's usually tender just above the joint line of your knee. Your physio or your healthcare provider can reproduce it with what's known as a Noble compression test, and generally imaging isn't routine unless the story is a bit unclear. It's tender where the band compresses over sensitive tissue near the outside of the knee, often at around 30 degrees of knee flexion, which bends when your knee runs. It's the most common cause of lateral knee pain in runners. So why does ITB pain happen? Generally, it's multifactorial, so we need to treat the pattern that we find, and it's not a one-size-fits-all list of common causes, but there are some particularly common triggers. Generally, these are quick jumps in training, which means that you're doing too much, too often, too soon, and this can either be in terms of distance or your intensity or both. Generally, it's flared up with more downhill running or running on cambered roads, so if you've got a new running surface and there's particular camber off the edge of that. It can be from altered running mechanics and sometimes reduced hip abductor capacity, which can lead to excessive hip drop and the knee falling in, known as a knee valgus. So that's that knee falling in towards the midline. So if you have ITB syndrome, here is your 4-step evidence-based guide to help manage not only current ITB syndrome, but to help stop it from happening again. I call these 4 steps the settle, build, flow, and go. So let's start with step 1. I would like to clarify that even though this is step 1, you don't have to progress from step to step to step. You can do these concurrently with each other, and everybody's going to be different, so you have to see what stage of these works for you. So step 1, settle. The goal here is to settle irritation fast while still keeping your fitness. So of course everybody is going to be different, but let's try for about 7 to 10 days. You want to trim your weekly volume. Generally dropping this by about 30 to 50% is a good starting point. In this time, you do want to keep your runs flat and you want to avoid downhills and cambered roads. You ideally want to run easy in this, but crisp. So what I mean by that is not a shuffle that's going to keep you in that more sensitive 30-degree knee flexion zone. In this time, you can cross-train if it's pain-free. So you might want to consider hopping on the spin bike. Make sure that that bike setup is comfortable for you, because if you keep that knee at that 90 degrees of knee flexion on the bike, you may still exacerbate your symptoms. Swimming is also a really good option, or the elliptical or cross-trainer. Short-term NSAIDs, so non-steroidal anti-inflammatory drugs, can be helpful, but I'm not a medical practitioner and I'm certainly not your medical practitioner, so you need to make sure that these are cleared for you and if it works for you. Any form of manual work or foam rolling for comfort is fine, but just know that this is symptom modulation. You're not actually going to be lengthening your fascia. And you really want to keep in mind with this that you want to avoid compressing the sore area, because it's compression that's already flaring this up. So if you are going to use a foam roller, please make sure that you're not foam rolling directly over the sore area, because you will further compress that area and make it more sore. If you're going to use it, you ideally want to target through your glutes, through your hip abductors. Okay. With this stage, you can progress this, given that your pain would be during an easy flat run. It would be a less than a 2 to 3 out of 10 during that run, and making sure that it's not worse in the morning. You want to keep an eye out for these symptoms, and they are going to be your real guidelines of knowing when you can progress. Now, step 2, build. Your goal here is to improve your hip abductor, glute max, TFL strength, and your overall general lower limb strength and control, so your ITB can see less compressive stresses. The key here really is strength and control. This is the backbone of this component. There was a really good study that was done looking at strengthening to decrease symptoms in ITB syndrome using a 3-level progression of exercise. This was done by Fredrickson and colleagues, and it demonstrated that in runners with ITB syndrome, 22 out of the 24 runners were able to return to pain-free running after 6 weeks of targeted hip abductor strengthening. Even better, at 6 months follow-up, there were no reports of reoccurrence of ITB syndrome. This program included exercises like side-lying leg raises, hip hikes and step-downs specifically to target that glute med and hip abductor strength. That's going to form the basis of our build phase, and I'm going to come back to these exercises once I've gone through the other 2 steps, and I'm going to give you some good examples in how you can implement them. Let's move on to step 3, which is what I call flow. You can implement these changes again alongside step 1 and 2. So the goal of step 3 is to change how the stress lands, not to turn you into a completely different runner. So some things that you can try to change the flow of your running is to test approximately a 5 to 10% cadence bump for 10 to 15 minutes inside of your easy runs. Generally, this means that you're going to have slightly shorter steps and that higher cadence, which is going to result in less knee and hip loading. Another thing that you might want to consider in changing the flow of your running is consider if you're what I call a tightrope striker or a tightrope runner. This means that when you're landing with your feet crossing over more towards the midline, looking like you're running on a tightrope, rather than your feet landing a little bit more underneath your hips. This can be really, really effective at fixing this to minimize that compressive force going through your knee. Some cues that I like to think about when it comes to helping runners do this is if you're running on a treadmill, you can draw a chalk line in the middle of the treadmill and try and practice running on either side of that chalk line and try and not let it rub away really quickly. Alternatively, if you are running outside, you can run as long as nobody's around you and you're going to interrupt their flow. But if you've got a line in the middle of the footpath, you can practice running with your foot landing on either side of that line. Now, you don't want to do this straight away for the whole duration of your run because having that big change may further load other areas. So you want to just practice these, like I said, for, you can start off with about 5 minutes of your easy run. Do that practice, make sure that you pull up okay, and then if that feels good, you can slowly increase the time that you're going to be working, thinking about your feet landing more underneath your hips rather than the tightrope, and same goes for your cadence. You can use a metronome to increase your cadence by that 5 to 10%. One thing that I really like to do if I'm thinking about my cadence is if I'm listening to Spotify when I'm running, I like to find a playlist that correlates with that increase in that cadence. So let's say that I'm normally run at 170 steps per minute. I know I want to increase it by 5 to 10%. So let's say I'm then going to aim for 175 steps per minute. I would then try and find a playlist that has 175 beats per minute. I listen to that and it helps to remind me to try and keep that cadence up nice and high. That's just if you don't want to listen to a metronome the whole time. Another thing that you want to think about when it comes to improving your running flow is avoiding excessively slow running. So often I find that runners, when it comes to ITB syndrome or really any injury in particular, is they'll say to me, Kate, it actually hurts less if I just run a little bit faster. And it sounds contrary to what you might think helps. You might think, but running slow surely means that it's going to be less load on there. But sometimes when you run slower, you're actually putting yourself for a longer time in that 30 degree of that knee flexion, which can actually flare up ITB syndrome. So you do want to keep that crisp, slightly higher cadence, and if that does mean that you run a little bit faster, as long as you're not going too crazy or running too fast the whole time, that actually can be really helpful. The other thing that you want to think about while you're making these changes is you do want to stay flat while your symptoms settle. So what I mean by that is staying away from hills, both uphill and downhill for the time being, and also staying away from the camber if that's possible. So if you're running somewhere and there's only camber around you, you might have to find a new running route, or you might have to run on a treadmill instead. You can reintroduce those roads with the camber or those footpaths with the camber later. Okay, there's our first 3 steps, and step number 4 is return to running. So that's what I call my go step. With this one, your goal is to rebuild your volume and frequency, and then you can introduce different terrains. So again, every runner is going to be different, but I'm going to give you some general practical guidelines here. So in practical terms, the runner should really have minimal to no pain at rest and in daily activities before you start bumping up your running. You should also be able to perform key tasks such as squatting pain-free, going downstairs, or jogging even on the spot, making sure that that's pain-free first. Many clinicians generally would assess you if you were to come in and see them using the ability to do a single leg squat with good control or holding a single leg stance position for 30 seconds first with that good control, like I said, to check before we really start to ramp up your training. Again, everybody is a little bit different with this one. But when it comes to starting to think about dialing back up your running again, you can follow these general guidelines. So in week 1, I would generally recommend that you run every other day easy and you keep the intensity really easy, but not too easy that you're spending a prolonged time, that knee flexion, but you know, that nice zone 2, keeping your heart rate easy, keeping it low, a nice conversational pace, and you're making sure, like I said, that you're running on flats only. Now, week 2, you can start to increase the frequency given that your symptoms are generally pain-free and you're not exacerbating your ITB syndrome, but you still want to keep this flat. You want to have small volume bumps, and a general good guideline is that for your longest run, you only want to increase the distance of your longest run by 10% here. Weeks 3 and 4, I would still be focusing on adding your distance. In here, you can add in a little bit of speed given that your symptoms are okay and that your pain is quiet, so you're not getting an exacerbation there. So you can start to introduce a little bit of speed work here. After week 4, if you're still feeling pretty good, you can generally have the green light to keep on progressing. Keep that pain to no more than a 2 out of 10. Make sure that there's no next day increase in pain, no swelling and no discomfort there. If you're following all of those guidelines, then you can really start stepping up here after week 4. If the knee is pain-free or it's just a little bit sore the next morning and that soreness doesn't accumulate over days, you can then continuously keep progressing from here. If the pain does flare up above a mild level or it does linger into daily life, that's a sign that perhaps you've done a little bit too much and you might just need to scale back the running and really reinforce the rehab exercises. Your key here also is to remember that as you are bumping up your running, whether it's the volume, the intensity, or you're starting to add back in hills or those cambered surfaces, you need to keep doing your strength exercises. You can't let them fall. They are going to be a part of your bread and butter, part of your daily life now. Well, okay, maybe not every day, but 3 or 4 times a week, especially if you're more susceptible to getting that ITB syndrome. So you need to make sure that you keep on doing those. So let's go back to that step and let's focus on some of these exercises that you can do. Now, following that 3-level progression, I'm going to take you through a couple of the level 1, level 2 and level 3 example exercises that you can do. And you do need to make sure that you keep on progressing your exercises. So these do need to keep on challenging you. I think that often we forget how hard running actually is and how much control is required when it comes to running, and how much we need to load that, especially if we're going into longer distance runs or we are running hills or we're introducing speed work. So the level 1 of this study used more what we call open chain exercises. So these are exercises where your foot is not planted on the floor or against something and it's open. So here's a couple of my favorite ones of these to do. The first one is a side lying leg lift, and I really like this because it does target those hip abductor muscles. So with these ones, there are a couple little technique cues that I do want you to think about. So you're coming into your side lying position, and with your top leg, you want to make sure that that is internally rotated. And that's the real key here to get the most out of this exercise. So that means that your toes are pointing down towards the ceiling, your heel is pointing up towards the sky, and I like to do these with a band. You can of course do them without a band if you find it too hard with a band, but with these ones you want to start with 3 to 4 sets of 12 to 15 repetitions. So we're adding a little bit more into the muscular endurance here, giving yourself about 60 seconds of rest in between these sets. And you're really aiming to put tension up into that band. So you're really targeting those glutes and coming back down again, keeping your leg in internal rotation the whole time. With these ones, you really want to make sure that you're doing these 3 to 4 times a week. Another really nice exercise that was in this open chain phase of these rehab programs is some clamshells. So clamshells, I feel like they cop a little bit of flack, and people say, oh, they're not the best exercise because they really just target external rotation through the hips, but that's still really important to target. And sure, they're not the best exercise if you could only pick one, but I think that in a good solid rehab program, they certainly have their place. So with these ones in that side lying position again, with the band around your legs, so you really do want to make sure that you're loading them up because they are a relatively straightforward exercise. So make sure you grab a band that's nice and thick for you. And with these ones, we're going to aim for those same set and repetition ranges. So your 3 to 4 sets of 12 to 15 repetitions, of course, on each side, giving yourself about 60 seconds of rest and aiming to do these 3 to 4 times a week. Make sure they are challenging. Be honest with yourself and make sure that you have a good, strong resistance band for these ones. So they're two good examples of those earlier rehab phases. Now moving on, we also want to make sure that we're focusing on control through the glutes, not only strength as well. So what that means is making sure that those hips aren't dropping excessively, or if that does happen when you're running, we've got that nice control and strength there to help correct that. Which leads me on to my next exercise, which I absolutely love. This is one of my real go-tos, especially for people with ITB syndrome, and this is a hip hike. And the reason that I like this is that it really directly replicates that hip drop that happens when you run and then correcting it. So it's really specific to running. With these ones, now, you can, of course, do these if you find them too easy, body weight, you can hold onto a weight, or you can put a cable around the ankle of your leg and add some resistance that way. But generally with these ones, we're still aiming on that muscular endurance. So you're aiming for your 3 to 4 sets of your 12 to 15 repetitions on each side with that 60 seconds of rest. These are ones that you should definitely pop in your program 4 times a week, and you can keep on progressing those and keep them in if you're particularly susceptible to ITB syndrome. Even if it's settled and you haven't had symptoms for a while, make sure these stay in there because they are such a great running exercise. Next ones that I really like that still focus really on that control side of things is a single leg sit to stand, or sort of a single leg squat here. With these ones, you're aiming for single leg, of course, because we run single leg, and what you're really focusing on here is trying not to let that knee fall in towards the midline. So you're starting in that seated position, you're using your glutes to stand up nice and tall, so you're getting some strength there on the way up, and then you're getting your control on the way down. With these ones, we really want to aim for good quality. So these ones, we're going to bring the repetitions down so we can really aim for the quality of this movement. So for these, I would recommend your 3 to 4 sets of 6 repetitions on each leg. Ideally, you can also pick your repetitions deciding on when you feel like your quality starts to lack. So when you feel like, oh, my knee is falling in and I can't correct it anymore, that's when you ideally should stop. So if you try another one, you go, no, that's not it, you can call it there. You can keep focusing on those repetitions. Then when you feel like you could do them with good quality, you could either increase the number of repetitions or you can hold on to a weight to make these ones harder. Then our missing piece of really building up the strength is making sure that we're loading up properly, more in the maximal and strength development zones. So we're making sure that we're building up the strength, particularly of your glute max, bit of that TFL muscle and your hip abductors there to really improve that overall strength. And 2 great exercises that you can do to improve strength through here is your weighted hip thrusts. So in this video, I've just got the kettlebell on my hips. Ideally, you would want to progress that into a barbell or some heavier weight so you can make sure that you're really developing that glute max strength. Not only great for ITB syndrome, but also really helpful when it comes to run performance. I've popped the band around here so I can put a bit of tension out into the band too, so I can get my hip abductors as well. With those, you can, of course, also do them single leg. Because we're aiming to improve more of that maximal strength, we're really going to bring that rep range down again. So we're going to aim for 4 sets of 5 repetitions at a relatively heavier load. And because we're going a little bit heavier, give yourself about 90 seconds of rest for those ones. The last ones that you're really going to focus on improving that overall strength, but also an element of control, is your loaded split squats. Here I'm doing a barbell split squat, so we really can load this one up to develop that strength, but you can of course also do a Bulgarian split squat with your rear foot elevated and holding onto dumbbells if you don't have access to a squat rack. Again, because we're going to aim for that maximal strength here, you're going to do 4 sets of 5 repetitions on each leg at a relatively heavier load, so we're really getting that stimulus there and giving yourself 90 seconds to 2 minutes of rest. You're really going to aim for quality. Try not to let that knee fall in towards the midline. Aim for that nice slow control down so you're getting some nice eccentric strength and powerful drive up, which replicates that nice push off when it comes to running. Okay, now I know that was a bit of an information overload, but that is the 4-step evidence-based general guidelines that you can use to help manage your ITB syndrome. So making sure that you're calming it down, you're working on the flow, you're building up the strength, and then you're returning to running sensibly, and you're working on all of those things nice and together. Now, please keep in mind that every athlete is different. The point of these videos is just to really help you get back to your running, help you run consistently and achieve your goals. But of course, if your symptoms don't settle, if you're not sure about the diagnosis, make sure that you reach out to your healthcare professional and make sure that you're getting properly managed with something that suits you. I really hope that you enjoyed this video. If you did, please make sure you give me a like and a subscribe so I can keep on making this content for you. I'll see you in the next video.